Community Analysis Presentation, Land O'Lakes, Florida.
This presentation encompasses our evaluation of the Land O'Lakes, Florida community. We will discuss its historical background and significance, an analysis of its structure, population, adequacy of health-related resources, environment, government, and public policies. In addition, the top 6 needs within the community will be presented and compared to a global issue. We hope you enjoy the information that will be shared with you.
The Land O'Lakes community began in the 1880s after the removal of the Seminoles. Formation of a stagecoach relay station was created between Brooksville and Tampa. This area was considered a census-designated place, or CDP, recognized by the United States Census Bureau. CDPs are considered small populated areas that do not have a separate municipal government. Through the merging of post offices and schools, the community was named Land O'Lakes on September 1, 1950, following a public contest. Located 17 miles north of U.S. Highway 41, Land O'Lakes has established production of major roads such as the Suncoast Parkway, State Road 54, and State Road 597 to create convenience for Tampa and Dade City residents. New housing developments have been built throughout time. In the past 10 to 20 years, Land O'Lakes has established new residential expansions, shopping centers, and schools.
There are various schools located within the community, starting from daycare and preschool age all the way through college. To name a few, we have KinderCare, Oakstead Elementary, Russia Middle School, Land O'Lakes High School, and Rasmussen College. For the most part, these schools are newly built within the last 10 years and have well-maintained structures. The only local public library is in the heart of the town. It is open 5 days a week and offers book clubs, story time, family, senior, and teen events. Next to the library is the Land O'Lakes Recreation Complex. It consists of over 79 acres of land with a variety of sports fields, a skate park, dog park, pool, outdoor pavilions, and so much more. Throughout the community, there are a number of churches from various denominations. Some of these churches offer Spanish-speaking services as well. The businesses include anything from restaurants, grocery, retail stores, drug stores, and pharmacy, gas stations, and banks. These establishments are modestly preserved and are easily accessible from major roads. Hours are flexible and the pricing varies to meet the needs of each of its shops.
During our windshield survey, we observed the majority of the community appeals to middle and middle-upper class. Most of the housing developments which are currently being built are advertised as priced from the 200,000s and up. Generally speaking, the facility grounds and houses within the developments are well maintained. Employment rates in the community are considered relatively high at 62.1%, with unemployment at a low 8.6%. This reiterates the fact that the community is prosperous and why it appeals to the middle and middle-upper class. The top communicable diseases are AIDS, HIV, sexually transmitted diseases, and tuberculosis. As community nurses, we need to be mindful of these concerns and how we can bring awareness to the population to prevent them from developing into a larger issue. We saw very few homeless people roaming the streets or camped out behind and around businesses, and only occasional panhandler weekend.
There are numerous primary care providers within the community. One of the commonly used doctor groups is Land O'Lakes Primary Care Wellness Center. Outside of primary care offices, there are urgent care, walk-in, and minute clinics. These places accept most insurances as well as cash payments. None of them, however, offer 24-hour care. The nearest 24-hour urgent care is approximately 20 miles away. For individuals without a primary care physician, the health department is open Monday through Thursday and offers wellness programs, clinical and nutrition services, community health planning, family planning, and infectious disease services. Additionally, dental services within the area offer normal business hours and have some emergency on-call hours. Our outpatient centers offer acute care services, medication management, treatment for most injuries and illnesses, and crisis intervention and support.
The 3 specific objectives we chose from Healthy People 2020's website for our community are access to health services, oral health, and substance abuse. The goal for health services is to improve access to quality healthcare provisions. Having accessibility will help increase discovery and management of health disorders. Due to the large community of tobacco users, we felt that oral health was an important topic. The goal of oral health is to prevent and control oral and periodontal disease. Oral health is crucial for overall health since oral disease, from cavities to oral cancer, can cause discomfort and debility for many individuals, hence affecting their ability to talk and make facial expressions to show emotion. Another growing concern is substance abuse. Our goal here would be to protect the health and safety of all and quality of life. Substance abuse significantly contributes to physical, mental, social, and public health problems.
Law enforcement serving our community is the Pasco County Sheriff's Office. They provide service on active calls, safety resources, arrest inquiries, and neighborhood watches. You will even see them at local school sporting events. The local fire department is Fire Station 28. They house 2 volunteer organizations under one department. On each call, the rescue unit is staffed with a paramedic and an emergency medical technician firefighter. Water and sewage is provided through Pasco County Utilities. They continuously monitor for contaminants in order to keep the community safe. Mosquito control is a problem in our community because of the amount of lakes. The stagnant water is a breeding ground for these pesky insects. Luckily, Land O'Lakes has Pasco County Mosquito Control, which helps to reduce the mosquito population via water management, biological control agents, and insecticides.
Community meetings are held to bring awareness of arising issues to its residents. Oftentimes, there are a number of public figures in attendance which allow the citizens to address concerns at that time. A few of our public officials are Mayor Pam Oakes, Sheriff Chris Nacco, Superintendent of Schools Kurt Browning, and Tax Collector Mike Fasano. Unfortunately, there is not a budget specific to our community. The budget is broadened to the entire county and addresses items such as Road and Bridge Fund, General Fund, and Municipal Service Fund.
As previously mentioned, tobacco abuse seems to be the #1 problem within the community. Residents not only smoke tobacco, but chewing tobacco is a contributing factor to the abuse. The community works with a group called Tobacco Free Partnership of Pasco County to control and prevent tobacco abuse. This group partners with Pasco County students working against tobacco and the Florida Department of Health to implement tobacco-free grant initiatives. Considering the vast number of fast food restaurants, we chose obesity as the #2 problem. On almost every street corner, there is a fast food chain with either a restaurant already there or being built, and sometimes more than one on the same corner. However, Pasco County has started a project called Get Healthy Pasco that aims towards healthy lifestyles for residents by increasing physical activity and encouraging healthy eating. Land O'Lakes is a community that most would consider a redneck city. One of the favorite pastimes for these individuals is drinking. Sadly, this has become a health and safety issue. On a positive note, the Alliance for Substance Abuse Prevention works with the community to implement initiatives including DUI enforcement, strengthening local ordinances, and community education on drug trends.
The issue we chose as #4 was the lack of rehab services, skilled nursing facilities, and nursing homes. When patients are discharged from the hospital and need to continue on for rehab or at a skilled nursing facility, they would need to travel to a place not close to their home since we do not have anything here. This could create caregiver role strain and may influence the patient to leave early because they feel guilty about the travel burden on their family. Fifth, we believe that traffic is becoming a safety issue. With the increase of developments being built and a lack of traffic lights at their entrances, there are more and more accidents at these intersections causing injury and occasional fatality. Lastly, the numerous conservation areas and swamplands bring about an increase in mosquito problems. As previously discussed, Pasco County Mosquito Control is working on this issue. In addition to insects, rodents and wild animals are a vector concern. The fact that so many trees are being torn down to make way for upcoming developments means that wildlife are losing their homes and will be more prominent on the roadways. This leaves drivers at an increased risk of hitting the wandering creatures and potentially wrecking their vehicles and obtaining injury.
Obesity is a global issue. Research has shown that worldwide, obesity has doubled since 1980. Where it was once considered a high-income country crisis, overweight and obesity are now trending up in low and middle-income countries, predominantly in metropolitan areas. It is linked to more deaths worldwide than underweight. Overweight and obesity, however, are preventable. Having supportive environments and communities are key to shaping people's preferences. Incorporating healthier foods and regular physical activities are the easy choices at preventing obesity. Get Healthy Pasco is a program that our community has adopted to accomplish this goal. The World Health Organization has created a global strategy on diet, physical activity, and health to incorporate exercise and healthy eating. This strategy challenges its participants to take action at the global, regional, and local level to improve diets and physical activity arrangements at the population level.
Thank you for viewing our presentation. The following slides include our references.